Okay, it looks like Pete is due for his 3-year distemper vaccine, his Bordetella vaccine. His rabies vaccine isn't due until March 2015. As far as his outside environment, is he exposed to any kind of wildlife or livestock, any raccoons, possums in your area?
Possibly.
Okay. Leptospirosis is a disease that they can get from those type of animals if he were to have exposure to them. Vaccine reactions are pretty uncommon, but the leptospirosis vaccine is the most common that we see a reaction with. So we just kind of do a case-by-case basis. If you were to be at risk for the leptospirosis, we would recommend that vaccine. Do you think that that's something you're interested in doing today?
Sure.
Okay. So we will do that leptospirosis vaccine. He will need to come back in 3 to 4 weeks for a booster, and then after that it'll be an annual vaccine. As another vaccine to consider is the Lyme vaccine. Is he at risk for any kind of ticks, any wooded areas or tall grass that he goes in with your walks?
Possibly.
Okay. We are seeing more Lyme disease in the area, and that vaccine would need boosted also. Do you think that you would be interested in doing that vaccine?
No, that's okay.
Okay. Well, what we can do, since you don't want to do the vaccine, is we could at least test for it. It's included in our heartworm test, so when we draw his blood today for the heartworm test, we can at least check and see his status of Lyme disease.
Sure.
Okay.
Let the client know what tests Pete is due for.
Like I said, he is due for a heartworm test. Do you need any heartworm prevention today?
Yes.
Okay. They do have a deal going on right now that if you buy the year's worth, you get a $15 rebate. But we do sell them individually. Do you know how many you would like to get today?
12 is fine.
Okay. And you did bring a stool sample, so thank you for that.
Let the client know which doctor they will be seeing by writing it on the whiteboard at the back of the door.
You will be seeing Dr. Sherry today.
Okay.
Excuse yourself from the room and let them know the doctor will be in soon.
Again, my name is Becky. If you need anything, Pete will be right back with you, okay?
Okay, thanks.
You are welcome.
Create an estimate including the vaccines you discussed, testing, and medication refills. Place this estimate with the chart for the doctor to have. Let the doctor know that you are ready while you drop all vaccines and prepare the estimate.
Dr. Sherry, I've got Pete for you in room 1. Alrighty, thank you.
Once in the exam room with the doctor, pay all of your attention to Pete.
Petey! How you doing, buddy? Did we bring you treats, huh? Is Becky your new best friend? Is she your new best friend? Huh? He knows that treat. Oh, good boy. Good boy.
I'm going to unhook him if that's okay.
Sure, that's fine.
All right, good boy, Pete.
Place Pete on the table if he is a small or medium-sized breed. For larger breeds, continue to make friends with them so that they are and placed in the area with the physical exam to be executed.
Good boy. Okay, turn around. Let me take a look at you, buddy.
Dr. Sherry wants to see you.
Get your cookie. Oh, you're going to stand up for me for the first part. Good boy.
Listen carefully to the doctor during the exam and key in on any signs of additional medications, procedures, etc.
That's a good boy. You're doing great. Oh, I know. Looking at your teeth is hard. And so he gets rawhides?
Yes.
Oh, every day?
Mm-hmm.
Excellent, excellent. Looks like it's doing a pretty good job. It's doing a good job. Oh, got a cookie.
Good boy.
He says, I'm starting to relax a little bit. I'll have my cookie now. Good boy. Look at your ears. Yeah. That's right. You've got two of them. Gotta look at both of them. Good boy. Excellent. His weight looks really good. Doing a good job. Keep him lean. That'll help his joints stay strong. He doesn't have any
Okay.
trouble getting around?
No, not yet.
Excellent. Switch forward a little bit, Petey. Good boy. I'm going to swing you this way. Lift it so I can check your back legs. And then do little doggy yoga here. Good boy, Petey. That's a good boy. Excellent. Good boy. Look at this other side. And you keep him on heartworm medicine all year round then?
Yep.
That's good. Protects him against intestinal parasites too, so that's important. Okay, mister, we're gonna peek on your tail. Just looking. Just looking. Good boy. Now, I'm gonna look with my scope. I always check and see down inside of his ears. The outside looks fine. We like to make sure the inside looks good too. Here you go, Peebo. Here you go. There you go.
Eat
Good
those
boy.
treats.
It's a scope. That's right. Turn this way. Good boy. Oh. You're doing fine, buddy. Excellent. We'll probably have to trade sides for this of it. Good boy. Same thing. Very nice. Good boy, Pete. Excellent. Alrighty. He looks terrific. Let's see. So,
Once the physical exam is done, position Pete so that the doctor can draw blood from his front leg for the heartworm test.
Boy, yes you are. Yes you are.
good boy. There we go. We just need a little bit. Do-do-do. You didn't even notice that.
Very good.
Good job.
Good.
Excellent.
Good job.
Good boy.
All right.
Give treats and praise
Take a step
as
forward.
to Pete as the doctor gives the vaccines.
Just a little bit back here. Good boy. Excellent.
Good job.
Good
job.
job.
Very good. He did a great job.
Excellent,
today.
Pete. Here you go, buddy. Good Here you go. Treat. Treat, treat. Oh, he's such a smart boy. Good boy.
Once vaccines and testing is done, take the white basket and all syringes with you and exit the room. The doctor will finish discussing the plan for Pete with the owner while you do billing, fill medications, and get the pink slip ready for any rechecks. At this time, you can also activate the True Panion form.
shoes may be a little bit difficult to getting up and down, so I think we're gonna go with
Okay.
we'll get that ready for him.
All right. I can get that ready. Thank you.
After the doctor has exited the room, return back into the exam room with the client.
All right. Thanks. His heartworm and Lyme disease tests were negative.
Yay.
So continue on the heartworm prevention.
Okay.
He's had this before, but this is HeartGuard. 1 tablet by mouth on the same day every month. So if he gets this on the first of the month, he'll get this on the first of every month.
Okay.
And there's enough in there for the whole year.
Okay.
You will get a rebate in the mail. We'll do all the paperwork. You'll just get a check in the mail. She was talking about doing an anti-inflammatory trial. So this is the Rimadyl, and you see the directions on here are to give 1 tablet by mouth every 12 hours. And
Okay.
these are chewable, and they usually take them pretty well.
Okay.
And I think he probably will too.
Okay.
So if he does well on that, give us a call and let us know.
Okay.
And here is a brochure about the Trupanion. Talks about all the benefits, and the free trial is here, and it has been activated. And he will just need to come back in 3 to 4 weeks for that booster.
Okay.
But he was a very good boy today.
Escort the client and patient to the front desk. Give the pink slip to a CSR and let them know Pete is ready to be checked
Are
out.
you ready to go, Pete? You are a very good boy. Pete is all ready to go. He just needs to come back in 3 to 4 weeks for a booster.
Reassure the owner that Pete did a great job today and say one final farewell.
Pete was a very good boy today, weren't you?
Good boy.
All right, we will talk to you soon, okay?
Okay, thank you.
You're welcome.